PMOS refers to polyendocrine metabolic ovarian syndrome, formerly known as polycystic ovary syndrome, is a complex hormonal condition affecting about 1 in 8 women worldwide. It involves endocrine, metabolic, and reproductive system. For too long, the name reduced a complex, long-term hormonal or endocrine disorder to a misunderstanding about cysts and a focus on ovaries. This contributed to misdiagnosis and inadequate treatment. The new name shows us that it goes beyond having cysts in the ovaries. The new name is also used in hopes to improve diagnosis and care of condition affecting 1 in 8 women worldwide. PMOS symptoms.
Symptoms are divided into 4. 1. Reproductive, 2. Dermatological, 3. Metabolic, and 4. Psychological. First, reproductive symptoms include irregular periods, infertility, and pregnancy complications because hormonal imbalance can disturb the ovulation process and menstrual cycle. Second, dermatological symptoms such as acne, alopecia, and hirsutism happen due to increased male hormones in the body. Third, metabolic symptoms include obesity, type 2 diabetes, hypertension, and high cholesterol, which can increase the risk of serious diseases. 4. Psychological symptoms such as depression, anxiety, and eating disorders may affect person's emotional confidence and mental health.
In conclusion, PMOS can cause reproductive, dermatological, metabolic, and psychological symptoms that may affect a person's overall health and quality of life.
Causes and risk factors. Number 1. Hormonal imbalance, disrupted estrogen, progestogen, and androgen levels. Next, insulin resistance. High insulin levels triggers excess androgen production. Lastly, genetic factors. Family history increases risk.
But don't worry, it be treated in a way, treatment and management. Treatment and management divide into 4 categories, which is lifestyle change, medication, fertility support, and multidisciplinary. Lifestyle change such as healthy diet, exercise, and weight management helps regulate insulin level, balance hormones, restore menstrual cycle, and improve fertility. Medication also help women with PCOS such as hormonal therapy, insulin sensitizer, and fertility drugs to manage symptoms, balance hormones, and increase the chance of pregnancy. Next, fertility support like assisted reproductive technologies to overcome infertility problem, for example, IVF, ICSI, and IUI. But not least, multidisciplinary care. It can provide comprehensive management such as endocrinology, gynecology, dermatology, and cardiology.
Hi, Assalamualaikum.
Hi, Waalaikumsalam.
Sorry to bother you. We have a few questions to ask you. Could you spare us a minute of your time?
Yeah, sure, why not?
Okay, first question. What is the actual procedure to confirm that someone has PCOS?
Well, from the research that I have done, they have to go through a procedure called diagnostic blood test, to measure their hormone concentration and to rule out the conditions,
Okay. All right. Next questions. Is it true that if someone has PCOS, they will be infertile?
Well, no, that's a myth actually. Women with PCOS can still get pregnant, but they will have to go through a treatment with like an OBGYN doctor for that, because it's slightly going to be a hard work for them. Yes.
Okay, alright. I totally agree. Okay, last question. Suggest one way for people to help people with PCOS.
Well, they can eat low glycemic index foods to manage their insulin concentrations.
Okay, that's all from me. Bye bye.
Hi.
Hi.
Sorry to bother you, but would you mind spare a minute of your time to answer all of our questions?
Yeah, why not?
Okay, the first question is, what do you think is the biggest mental challenge for to face by women with PCOS?
People with PCOS will experience emotional stress such as anger and sadness.
Okay, the second question, what physical what physical symptoms that the most difficult for women with PCOS to manage in their daily routine?
It will be weight gain, excess hair fall, and fatigue.
Okay, good. And the last question is, in your opinion, what effort can society make to help a woman with a PCOS?
In my opinion, I think we can provide support and advice to women with PCOS.
Okay, that's all from me. Thank you for answering all these questions. I hope you have a great day. Bye.
Bye. Bye.